Good morning and welcome to this week's episode of Ask Dr. Murphy. I hope everyone is doing well. My name is Katie Berg and I'm a research study coordinator here with the Havey Institute. I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Good morning, Dr. Murphy. How are you?
Good morning. I'm doing great.
Great. Our viewers will remember Dr. Murphy as the Executive Director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases at Northwestern's Feinberg School of Medicine. He answers your COVID, infectious disease, and public health questions each week on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be answering viewer-submitted questions and addressing the latest headlines through today, July 6th. We invite you to submit your questions below via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. I'm going to start with some updated COVID statistics for the United States. As you know, we have not been getting updated case numbers, but the average is around 10,300. The numbers we are getting updates for, the average new hospitalization per day is about 885 people. And the average COVID death per day was reported at 28, sitting tight at 17% new booster proportion, Dr. Murphy, do you have reactions to those numbers?
Yeah, it's really great news. And it just tells you that we are still learning a lot about this pandemic. This drop in the mortality rate is great. It really means that we've been able to control the current variant floating around between a mixture of vaccines and natural immunity from getting prior infection. And that is really the fact that so many people have taken the vaccine or gotten infected, some people multiple times, like myself, I had it twice. Plus I had all 5 vaccines. So there's so many people out there with immunity that this is the result. Now, still, almost 1,000 people are going in the hospital every day in the country. So this is, but the treatment is on top of everything else. The treatment is really good. You have the oral treatment, Paxlovid and molnupiravir. There's more coming up the pipeline, down the pipeline. You have remdesivir, we talked about metformin, one of the drugs that's used for other diseases as well, that also has a 40% effect. So there's just so much out there. There's high dose steroids if you get really sick. So, it's become, a common enough disease that, people know around the country, know how to treat it and treat it very aggressively. And so you see this mortality rate really going down. And so it's just great news. I hope it goes down to 0. The big risk is a new variant comes along. Like, remember, Delta came along, and then Omicron came along. And so, now we can handle those variants, but, we don't know about the future, but we'll see. But so far, so good. Good news.
It's important that we stay up to date with our immunity and get those vaccinations so that we can keep those numbers hopefully where they are.
Well, particularly in high-risk people. So the higher risk you are, please, continue with the vaccination program. There will be new vaccines coming out this fall, a modified vaccine, all the same companies, but they are gearing it specifically just for Omicron. So remember, the last updated vaccine was September of 2022, and half was for the new variants and half was the old. The old probably doesn't do anything anymore. So this new version will strictly be focused on Omicron. So it should even be stronger, more effective. So, you can still get sick and end up in the hospital. You can get sick and stay home and feel awful. But and one thing I've noticed with a couple people that I've been involved in as patients or family members or friends is that people are getting COVID all the time. We just canceled a big dinner that we had planned for this weekend. actually with my own hospital group, and the host just got COVID. So, and then, people are just popping up with COVID all over the place. They're getting sick. They're taking Paxlovid if they're eligible for Paxlovid. But the other people in the family, interesting, just in my own personal experience now, is they're not necessarily getting infected. Remember at the beginning, if somebody in the family got it, like almost everybody in the family got it, or, it was over 50% attack rate for family household members. That I don't think that's true anymore. It's really kind of surprising what's going on, but this is all really good news, but we still have to be careful.
Absolutely. And it'll be really interesting to see what research comes out in the near future surrounding those topics.
Mhm.
We're going to move on to a submitted question that we received this week. Thank you so much for submitting your question. And again, we welcome you to submit questions below or by email. This person was asking if you are someone who is suffering with long COVID symptoms and have been for even a long time, several years, what level of risk do places like indoor restaurants still pose to them? And what is the current risk of exposure, say, on an airplane? Are these high risk activities for that population?
Yeah. So this is a couple of different questions. Let's take them apart one by one. One is about long COVID. All right. There are a lot of people with long COVID. There's more people now with long COVID than COVID. And kind of in general, we're still under study, intense study, that people do tend to get better over time. There's no magic here. There are treatment for some of the symptoms. We don't really know what's causing this, so we don't really know how to treat the underlying problem. These people, about 6-7% of the people that get COVID, have long COVID. But the good news is that it does tend to get milder over time, even if you have the neurologic symptoms. And so it's just treatment, observation, and supportive care. Now, in terms of risk, remember, there's two things about risk. There's how much virus you get exposed to, like if you're in a poorly ventilated, crowded restaurant, all right? And there's the immunity of the people in the restaurant or the crowded place, wherever you happen to be. So it's those two factors are very important. At the beginning of the pandemic, it was so risky to be in groups because nobody had an immunity. Now, like over 97% of people have some kind of immunity, either from the vaccine or prior infection. So an indoor restaurant now is probably not very risky. Now, of course, there's higher risk and lower risk. If it's a nice spread out restaurant with good ventilation, maybe it's got the doors open in the summertime or whatever, that's low risk. You're eating outdoors, there's almost no risk. If it's a crammed, jam-packed, you'll have an increased risk of getting infected. So it's not like there's no risk. There's always going to be risk now, because this is just another pathogen that's out there. And we're seeing a lot of cases. So we're seeing cases all the time. And unfortunately, now it's not reportable. So, we don't really know how much it is, but every doctor I know said, in my own experiences, there's just a lot of cases happening, but they're mild. They're generally not going in the hospital because they have this immunity. So your level of risk in an indoor restaurant, just like any other indoor activity, is low. But there's a low and lower, all right? And then as far as airplanes are concerned, it's kind of the same story. And we're not seeing big outbreaks on airplanes anymore. And again, it's because of the worldwide immunity that we have to COVID. Now, there's not a lot of cases happening, but there's been no reports that I've seen that have tracked back, a whole airplane full of people became infected. That occurred at the beginning of the pandemic, but it is not happening now. And it's the same kind of story we see with the restaurants and other indoor spaces. So it's kind of all kind of one same story. So it's due to the immunity of the population that's keeping that so low. Like I've been on a lot of airplanes lately. I'm traveling again, and I would say mask use is less than 10%. Certainly, if you get on an airplane and you're immunocompromised, you're elderly, you have an underlying medical condition that puts you at risk, some underlying cancer or heart disease or something, yeah, you should wear a mask. And especially if you have any symptoms. If you have symptoms, you should test yourself for COVID before you even go. And then if you have it, you should follow the usual guidelines. 5 days isolated, by yourself, avoiding other people. And then 5 days you can wear a mask and go out. I mean, that's basic rules. So, so the total is like 10 days. But it's, we're going to just have to live with that from here out. So that's kind of the story there.
Mm-hmm. And speaking of, we talked a lot about kind of immunity in there. Moving on to one of the headlines, there was a recent study that found that almost 1 in 4 people in the US had not gotten COVID by the end of 2022. Can you give us a little more information about that study and their findings?
Yeah, this is the Centers for Disease Control. And they're reporting, and this is what they're famous for doing, by the way. And they did a big study that at the end of 2022, they tested, a whole lot of people. And you can do antibody tests, and some of the antibodies are specific for you having been infected versus you had the vaccine. So the vaccine gives you the spike antibodies, and the infection gives you spike antibodies, but also other antibodies like nucleocapsid antibody. So you can tell if somebody has had real infection before, or it's just from the vaccine. And I think it's surprising that so many people, approximately a quarter of the people, never got COVID. Now, they had, turns out, like 90, I think it's in this report here, 96.7%, almost everybody have some antibodies. So, it most likely is that the people that got the vaccine early and then never got infected. So it's that's most likely what is driving this particular number, or somebody who mitigated their behavior to a great extent. Never went out without a mask, never went to crowded places, and they never got the vaccine, and so they didn't get it. But it's higher than the number of people who have not been infected is higher than originally we anticipated. We anticipated really almost everybody would get infected, but this is not true. But that's good news, because it's most likely driven, this whole thing is driven by the vaccine.
Yeah, it's very, very interesting to look at, particularly when breaking up the hybrid immunity versus, what antibodies you have and from where.
Right.
And
in the hybrid, to bring it up, and we've talked about this many times, if you have the antibodies from the virus and the antibodies from the vaccine, that's even better than either one alone. So that will protect you. So this is just all very fascinating, and it's really overall really great news that we finally reached this herd immunity, and this is going to be an endemic infection that will kind of fade into the background, and we'll just forget about that. We had a couple of really wild, crazy years and made it through.
Mm-hmm. And speaking of COVID getting into the endemic stage, there was a recent study that came out that showed that other diseases such as RSVs, their seasonal patterns may have shifted around the COVID-19 pandemic. Can you let us know a little bit about that?
Yeah, so RSV stands for respiratory syncytial virus. It's a disease that can really severely affect very young children under 2 years of age in particular, and older people who are very immunocompromised, particularly transplant patients, people who've had an organ transplant, whatever, and people that are otherwise very ill. So the severely immunocompromised and the very young people. And it was always kind of a seasonal thing. And typical seasons were November through March. But now it's kind of like all over the place. The seasons are starting earlier or later and going longer, and it's kind of continuously showing up. A lot of this is due to the enhanced surveillance. So now, whoever thought of RSV, I mean, except for like doctors and infectious disease people and people that work in this field, I mean, the average person in the population would never think about RSV. It just wasn't, part of the lexicon here. But now people hear about it. Testing is very simple for it, just like with COVID. And now what they have is what's coming forward are these multiplex assays where, if you have symptoms and you're going to test for flu A, flu B, COVID, and RSV. So once you start testing like that, you're going to find lots of this stuff. You're going to find all these people that have colds or, I got a flu, even though it's not the influenza. A lot of them have RSV. So you're gonna see the diagnosis increase significantly. And this RSV thing is really the pattern of RSV as we knew it has just really changed dramatically. So the disease is either changing or it's just that we're diagnosing everything so much better. I don't know. But why is it important? It's important because there is a vaccine for RSV. And people at risk, like I mentioned, should consider the RSV vaccine. We don't know if you're going to have to take it every year, like a flu shot, or it's going to be every couple years, or who knows what. But there are vaccines now. Pfizer and GSK both have vaccines. They work about the same. They protect you from serious disease. They're like 94% effective against severe disease and highly effective. So they are approved, and they're not available as yet that I'm aware of, but the availability will be soon. So this fall, when the whole like flu season starts again, people should be getting their updated flu shot. They should be getting the new COVID vaccine, which is all geared towards Omicron, and they should be getting the RSV vaccine if you want to protect yourself from getting a severe pneumonia type disease from any of these viruses. So they're all basically becoming preventable. And this is really great news because pneumonia is bad. Pneumonia can kill you. And particularly if you're fragile, elderly, have underlying disease, these things can save your life.
Absolutely. And to be clear, those RSV vaccines were approved for adults over 60 and, like Dr. Murphy said, recommended for those especially with underlying conditions.
Right. And there's them out there and they work about the same.
Absolutely. So if you can get your hands on one, don't hesitate. Moving on, there is some really, really big news in the funding world. There is a huge donation going towards the phase 3 trial of a TB vaccine. Can you tell us a little bit about the funding and also why that vaccine is important?
Yeah, well, TB is worldwide, is a deadly, anywhere you get it, it can be a deadly disease, even though there's treatment for it. There's been treatment for TB for decades. However, still, in 2021, 1.6 million people worldwide died from tuberculosis, treatable disease. The treatment is hard, though. You have to take it for months. You got to get monitored. There can be drug resistance, all this stuff. So now TB is a bacteria. So it's not a virus. It's very different. And the Gates Foundation and the Wellcome Foundation are together ponying up $550 million for a TB vaccine candidate that's been in development for quite a while. And it was originally developed by GSK, pharmaceutical company, who then licensed it to the Gates Foundation. The name of it is AS01E, if anybody cares. And it focuses on the GlaxoSmithKline adjuvant system. That just makes the vaccine work better. It's part of the whole vaccine process. So anyhow, in previous studies, so in the phase, what they're funding is a phase 3. This is the definitive study. If this works, it's everybody in a TB risk country is going to take this. So the previous studies, which had hundreds of patients in them, was nearly 50% effective. And, you say, oh, 50%, we know the COVID vaccines were over 90%, and, other vaccines are in the 90, 99, but this is 50%. But look, 1.6 million people are dying from tuberculosis per year. That's 800,000 people per year that will live. And if you remember back in the beginning of the COVID vaccine development, the efficacy that we were looking at was 50% or better. Everybody was shocked when it was like 90%, So, but 50% will have an enormous impact on TB because, the treatment is very long, it's complicated, there's multiple drugs involved, they've got side effects. And I mean, you can do it, but it's not the simplest thing. It's not a 5-day treatment of Paxlovid, let's put it that way. It's like months of therapy. So this is a very, very important thing. And it's the first vaccine since the BCG vaccine was introduced in 1921. So it's been a little while. Over 100 years since the next one comes out, but this will be a huge advance and worldwide. And if you travel in low and middle income countries, places where there is a lot of TB, you can still get TB. So travelers do get it, so it's good for everybody.
Absolutely, and we will certainly be keeping an eye on that for any more updates that come out. I would like to thank you, Dr. Murphy, for your time and expertise in answering these submitted questions and reacting to these headlines.
We have one more story.
We do?
Story.
Well, look at that. A bonus story. I'm off my rocker today, people.
Yeah, no.
But this is a really, really important story. We got to talk about this. So some patients, we talked about earlier that there was a fungal meningitis outbreak, but there's been some more surprising complications and updates on that. Please share them with us.
Yeah, okay. So we talked about at the end of May, 5 cases of fungal meningitis in Texas in people that went to Mexico to have plastic surgery or some elective surgery. It's a big industry down there. It's relatively inexpensive. The doctors are pretty well trained. They have a good track record in doing the procedures that they're doing. I can't speak for all of them, but I mean, it's a real common thing for people to go down there and have it. It's a whole industry. So unfortunately, similar to what happened to the United States about 15 years ago, people started getting this fungal infection and a severe fungal infection. And I think when we reported there were 5 cases and 2 of them had died, and this was in May. Now 7 people have died, 30 to 40 people have become infected, and 150 additional patients are under investigation and are likely infected. Many of them will be infected, is being proved now. And so most of these people are young women, otherwise healthy, from 23 states in the United States who went for a cosmetic procedure at one of these centers in Mexico, and they had epidural anesthesia. So the anesthetic went right into the spinal fluid and was contaminated with Fusarium solani, which is a fungus. So they know what causes it. They know it's quite serious. They have all sorts of, because it's in the spinal fluid, all sorts of neurologic symptoms and complications, and the treatment is tough. It's 3 to 6 months of anti-fungal therapy. And so the people that are under therapy right now, they don't really know the total outcome because they're not cured yet, because the treatment takes so long, 3 to 6 months. So it's a very serious thing. So people that I think because now people from 23 states have been reported, if anybody had a procedure down in northern Mexico there at one of these surgical centers, and they're feeling any kind of illness, they need to get checked out. It's very important.
Absolutely.
Yep.
Some very severe results that have been seen. So thank you, Dr. Murphy, not only for your expertise, but for making sure we include that very important story at the end there. Much appreciated.
Thank you, Katie.
And thank you to all of our viewers for continuing to watch. We invite you to submit questions below, and we will see you next week. Thank you very much.
Bye-bye.